is it that pharmacists their reports are not good enough compared to those of others? The workload is a big problem. Now, many of our pharmacists are running into supply chain management. Many are leaving the hospitals for greener pastures. So the few that are remaining, it becomes a huge task. And instead of, the workload is increasing. The programs are expanding, more and more clients are coming. So it becomes very, very difficult. So look for innovative ways that you will do these things so that the pharmacy, the report that are coming will be something that you can really work on. Then you said the percentage of reports have dropped a lot. I mentioned something earlier, reporter fatigue. That is the area that you need to look.
Sorry, sir, you can provide feedback so we don't get lost in emotions.
Okay, thank you very much. Thank you. UMC, the Uppsala Monitoring Center, recommends that the adequate reporting in terms of reporting rate of a country is 200 reports per million population for a country. In Nigeria, if we say we are 175 million people, it means 200 reports per million population per year. We need to be reporting about 35,000 reports per year. In 10 years, we have just about 17,000 reports. So we don't have enough reports. So we shouldn't, let us be encouraged, let us not be fatigued, because we've not really done enough to be fatigued. Then the feedback, the feedback, I think as a people, that is what we need to work at. My teacher always tells me, research is observation and comparison. Now the difference between you and the professor is that when the professor observes and compare, he documents his observation and have them peer reviewed. But maybe in some cases, in our own cases, we don't document. Now, so that really is the issue of documentation and use of these documents. So it's an attitude as a people. We need to work on it as a people. Thank you.
So as to calm the nerves of our colleagues, I think what we are asking for is some feedback from NAFDAC, even on the 13,000 that we have submitted. So when we ask for feedback, like Bravo mentioned, within the HIV/AIDS team, we're doing quantification, we're looking at doing a supply plan, we're looking at drugs that we're going to place orders for. New drugs are coming in. We would like to get feedback from the field on this is the kind of drug reaction that we've been getting. Case in point, on efavirenz, we've been getting a lot of reaction from patients, and that is now why now we're starting to look at other options. So that kind of feedback also on a quasi-regular basis from NAFDAC will help and guide some of the work that we are doing going forward. Thank you.
Just to quickly add to the responsible access, we can't draw lessons from some other countries, smaller countries who try to also do integration of a supply chain, and they find out that when you fix the supply chain, you find out that the desire, that very desired outcome is not really achieved. So they also begin to look at the issue of the rational medicine use, which pharmacovigilance and other things will come into. So I know the ministry, the Department of Food and Drug is doing a lot, but we also want to use the opportunity to also let them look at the other aspect in terms of rational medicine use, pharmacovigilance, antimicrobial resistance, and how all of this play around with the supply chain. Getting the medicines there, and also making sure that those medicines are used responsibly, because ultimately we are looking at the outcome. Yeah, so we're happy that the director is here, and she's going to take that up.
I like standing up, because I was just asking, the ministry, what we do, we are particular about policy. And we have policy capturing all these issues. Pharmacovigilance, we have the one for supply chain. Even the AMR now, we are working on it, or working as a team with NCDC. Now we have the agencies like NAFDAC as the implementing body. And of course, these are components of supply chain. Supply chain is not just taking the medicines from one point to another. Things about pharmacovigilance, AMR, and what all these other issues are very, very important. How this rational use of these medicines are very, very important. Of course, Ministry of Health, being championed by the Department of Food and Drug, handles the policy component of it, while the implementing agencies like NAFDAC, are working on that. Thank you. Any suggestion, inputs, any from others? Yeah, you want to say something? Other questions?
Yes.
Other one or still on this sub? Okay. Your name?
Okay, my name is Jamila Malabu, and I work with Health Strategy and Delivery Foundation.
Can anybody see her? Good, I can see you.
Okay, so my question was for NAFDAC as well. And the question is, are there any deliberate channels or mechanisms to disseminate some of the information that you find on AMR and ADR to service delivery points as well as the general public?
Okay, the department in NAFDAC, that's the pharmacovigilance post-market surveillance department that handles issues on pharmacovigilance, ineffectiveness, quality issues, post-marketing surveillance. We have quarterly newsletters. However, I can say really that the reach of this newsletter, probably we need to do much more to make sure that the newsletter gets around to the desired endpoints. But we have quarterly newsletters wherein NAFDAC brings out analysis, quarterly analysis, including of ARVs that are being distributed, the adverse drug reactions that are being reported. But I think the disconnect here is that the reach is not there. So I would say if there are organizations here that would probably support NAFDAC to probably build a listserv or a database of health workers that will be getting this information, because really, if we get this information without getting them to desired endpoints, it's really of not much use. Thank you.
Can we suggest that if the newsletter is available as a soft copy, as a PDF, you can get an extensive mailing list from the NSKIP program that includes practically all the TWGs, most of the implementing partners and the SRs. That's a good place to start sharing this information. So if we're sending this out to everyone as it comes out, so that way the reach is extended. I also wanted to mention there was a point that Dr. Jait made during his presentation on the mini labs. And I think within our supply chain in Nigeria, we need to explore that more. It is something that USAID has funded in other countries. It's like a suitcase, not even a suitcase, like a briefcase. And it's a full lab, so to speak, to just be able to check the quality of what you're sending out. And it's something that I think if we speak with our colleagues as we're doing the work within the NSKIP now for the hubs, maybe each hub should actually have one of those so that they can do like periodic checks and samples on the medicines before we send to the, like you said, the WHO approved lab for QA. Thank you.
Okay. My name is Stephen Balami. I want to ask a question to NAFDAC. Please, I want to know what NAFDAC is doing about antibiotic residues in meat, egg, and milk. Because every day we conduct research on some of these things, and we find out some of the residues are very scary. And I We happen to work on one of the antibiotics that we're even told that even if you boil the egg, the concentration increases. So, and the awareness is very low. It's very, very low. If you go to the field, somebody will just inject an animal. The next moment the animal wants to die, he will slaughter it, and the meat will find itself to the market. So please, I want to know what NAFDAC is doing.
I want to stand to answer your question because I'm afraid I don't have all the answers. But I think it's something I'm happy we have all seated here. It's something we have to look at again as a people, as a country. I think there are policy issues around this. Now, NAFDAC only regulates and controls packaged products, commodities, not agric produce. Now, antimicrobial residues born out of farm produce or farm ways of farming, how people use antibiotics in their fish farms and all of that, does not fall under the purview of NAFDAC. And so NAFDAC does not regulate that. I'm being told here that it's the Ministry of Agric that does that. So we need to really maybe look at our policies, unlike in the US where FDA actually does all of that, right? So it's easier in the US to track. But in Nigeria, it's not like that. The Agric Ministry is there. Then NAFDAC, of course, is in the Health Ministry. It's something we need to look at again as a country. Thank you.
Good afternoon, everyone. My name is Fatima Abdurrahman, and I work with FCT LMCU. So let me start by adding that I think the pharmacovigilance report, the pharmacist may be incomplete because there's actually a portion that should be filled after the patient has gone back to the doctor, if a prescription has been changed, and all that. So it may be easier for the doctors and nurses, since the folders are there, to complete that part. And sometimes really, because I have done it before, you keep it aside and say, when the patient gets back. But the way the pharmacy operates, you may not be the person that will see that person when he comes back. And then at the end of the day, the file is just there, and then you just add it to the ADR file, and it's gone. That's by the way. Then back to my question regarding malaria. ANC coverage, we're still trying to increase ANC coverage. And we still have states that we're trying to increase ANC coverage, and we still have states that give free SPs. So if the patients are saying that they prefer, because that was one of the things you concluded with, they would prefer the testing and then the giving of the antimalarials. I'm just, curious, at what level? Is it the secondary facilities? Is it the PHCs? At what level was the study, conducted, and was cost factored into it? Because if they are aware that, the SPs are way cheaper than the artemether lumefantrine, and then when you now factor in the cost, then it increases. Thank you.
Okay, thank you very much. The facilities cut across both primary and secondary health facilities, and it cuts across because I used 5 centers, and 3 of these centers were in the urban areas, 2 were in the rural areas, and those facilities in the urban area, 2 primary healthcare centers within the urban region, urban area, with 1 secondary health facilities. So the cost here, yes, the cost of screening will be a factor or a problem to consider. But we know that with time, maternal and child welfare, health will eventually be enlisted among some of the free care services that will be taken care of by the National Health Insurance Scheme. So if that can come into play, then it will take care of any cost that the participants or pregnant women may incur. Even though in this particular study, all these tests and drugs were given free. Yes. So we envisage a situation where these services will be taken care of by the National Health Insurance as more are enrolled. Thank you.
Thank you very much. We'd like to thank all the members of the panel. We'd like to thank the audience. It has been a very engaging session, and I'm sure everybody had been looking for an opportunity to have NAFDAC in the room, which was why practically all the questions were directed to NAFDAC. Thank you very much. I think we're ready for the next stage of the event. Can we give a round of applause to the lecturers for a good work on?
Thank you very much, sir. Can we all please rise? Thank you, sir. Okay. Are you ready? Are you ready? To get the occasion started, can we all kindly please rise for a rendition of the national anthem?
Yes. The Honorable Minister, sir, the Director of Food and Drug Services, our distinguished guests, please, may I take the permission from the yes, from the Honorable Minister to call members of the high table. So we have the Director of Food and Drug, GMO Chukuma, already standing. We have the head of the Supply Chain Department of the Global Fund from Geneva, Martin Ellis. Martin Ellis, Honorable Minister, Martin Ellis, head of. We have Professor, yes. So we have Professor Yahuda Basok, Professor, University of Southern California. And we also Professor Ravi Anupindi from University of Michigan, USA, as well. Professor Ehiji Enato from University of Benin. Then we have the President of the Pharmaceutical Society of Nigeria, Pharmacist Ahmed Yakasai. Please, can we see you? The Registrar of the Pharmacists Council of Nigeria, Pharmacist Augustine Ezogu, representing the Registrar. Can we see? Yes. The anthem. Okay, don't want anthem. This one. Okay, where's the switch? Okay.
Let's start with the anthem.
Oh, yes, yes.
Okay, ladies and gentlemen, let's kickstart the opening ceremony with a rendition of the national anthem of Nigeria.
Minister.
Started the opening ceremony. Where are you with the ceremony?
No, we are almost done.
Oh,
It's to open at 3.
oh.
Announce it now. Introduce it now. So let's.
Let me formally welcome everyone to this event, which I'm told will double both as opening and closing ceremony. I also want to hint you that one of the decisions we took at FEC is that we must be businesslike in Nigeria and really attend to the way we do protocol, and waste so much time trying to recognize the living and the dead. So I'm just going to say, Mr. President, Chairman, distinguished ladies and gentlemen, and then I'll move on. And to express my delight being here at this important meeting, sometimes ago we had a meeting, a workshop on logistics and supply system. And I did mention that when it comes to health service delivery, two things are very critical: the human resources and the commodities. If there are human resources and there are no commodities, we do not have a system. And when you have human resources and there are no commodities, you don't have a system. And so, having this type of meeting to me is of importance, and I want to express my delight to be here. I'm told that we have participants from all over the world, and I want to specially thank them for being here. I'm quite delighted to see the array of faces here, and to thank you for making it to Nigeria, and particularly to appreciate Global Fund representatives or US government, the academia that are present at this meeting. And I want to assure you that having a maiden edition of a conference is one thing. To be able to sustain it is another. I honestly hope that this will not be the end, because having number one is challenging, but number two is equally challenging. So I hope you'll be able to sustain the initiative. I'm also told that this meeting is holding to really showcase Nigerian local content success story, particularly to other African countries, and that you are facilitating a platform to share experiences, best practices, and so on and so forth. And I believe that in the last 2 days, you've been able to do justice to this topic. As I've said, access to essential medicine is critical to reaching universal coverage, which has become a household slogan. And I'm also happy that the new DG of the WHO said UHC is the way to go, and that there will be no excuse for any nation not being able to provide access, quality, and affordability in the context of healthcare delivery. I want to recall of our previous efforts and challenges in the Federal Ministry of Health. This is no longer a story. Since we have someone from Global Fund here, we're aware of the challenges we had in the past with procurement, with supply management systems, and other products, which resulted in community wastages, expiration of vital drugs and medications, stock out, and so on and so forth. And we got penalized by Global Fund. Not only that, we are also really engaging in Global Fund with respect to a few other things that we need to do. I do not want to tell the whole story. But then Global Fund has requested that we should modernize the way and manner in which we handle logistics supply system. I want to use this opportunity to reassure Global Fund that we'll keep to the terms of agreement, the undertaking that we gave to Global Fund, that we do things right, and that never again in the history of our country shall we allow drugs to expire when Nigerians need the service. I want to particularly appreciate Global Fund for the commitment. I know that 2015 to 2017, you committed close to $1 billion to the Nigerian system, not only And over half of this is on commodities and procurement system. And we know that commodity procurement is actually the poisoned arrow. So we're trying to modernize the procurement system in a way that will pull together resources, will be more competitive, more open in the way in which we procure this system. And we're also working together to ensure that a network of logistics system is in place. We are proud to showcase the warehouse in a box that is in Abuja, ready for commissioning. It's a fantastic base. I hope some of you will find time to visit that place. You'll be highly impressed. Another one is in Lagos, and we will then have a network of other logistics supply bases where we can network and ensure that medication commodities can get to the last mile. The important thing is that we must be able to deliver them to where they are needed. And we will also implement the principle of first in, first out, and also monitor closely the expiry dates and make sure that we will not take any drug or product into this country with a short shelf life. We want to have commodities that have some mileage in terms of dates of expiration, so that we will not just stay and take in things that are going to expire in 2-3 months. And before you know it, they're expired. We won't do that. During the same period, we are also aware that GAVIC, USAID, and many of the agencies are also supporting us. And we want to thank all of you and to assure you that we will do you proud in the manner in which we handle our supply logistics system. I'm told that the main focus of this conference is, one, to explore and provide an understanding of in-country health supply chain system as well as management, to review strategies for tailoring supply chain methodologies to challenging working climates, the Nigerian lessons as case studies, provide opportunities to teaming number of supply chain practitioners in Nigeria, and showcase various innovative approaches that we have. I'm also aware that this meeting will allow for the promotion of local participation, particularly with respect to in-country supply chain management, discuss local problems and solutions, as well as providing useful solutions for the region and international audience. What is also important, as I've said, is the collaboration. No country can do it alone. So we need to work together. We need to learn what has worked in other places and discard what is not working here. What matters most to our people is they must get it at the right time, at the right price, and of the right quality. And having a sound and robust logistics supply system will allow us to do this. I want to really appreciate the organizers, the Nigerian Supply Chain Integration Project, and also the University of Benin. I expected to see your Vice Chancellor here. We were on the same flight from Benin to Abuja yesterday. I thought he was coming here. Oh, he was here yesterday? Okay. Give my regards to him. And I asked the question, why Benin? You know I'm an Ibadan person. So I said, why Benin and not UI as well? I think I can conveniently, on behalf of the Vice Chancellor of University of Ibadan, to say Ibadan is also interested. Let me thank all our partners, USAID, Global Fund, DFID, UNFPA, Bill and Melinda Gates Foundation, UNICEF, Private Sector Health Alliance, and other local and international partners. I want to thank you for putting this together. I believe that in the course of this, we will be able to really look at what we have in Nigeria, discard whatever is not working, reform what we have, and come out with what is best. Not only with relevance to Nigeria, but with relevance to international practices. I think what is Nigerian is not good enough. We must be able to get it right in a way that the entire international community will say, yes, they have one of the best logistics supply system in Nigeria. I hope that this meeting will continue with respect to the expectation. I'm sure you've met your expectation in terms of the participation, local and international, exchange of information, making new friends, getting to know what is happening in other places. I hope that you've been able to meet these expectations. And I also believe that a rich mix of local and international participants will help us to come out with the best ideas that will help to promote things better. I also believe that at the end of the exercise, the Nigerian supply chain system could be richer and better. And I honestly hope that, as I've said, this is the first, it will not be the last. And that the next meeting will be richer. And on behalf of Nigeria, I want to thank you for coming here. We will have no objection if the next meeting is also here. Lastly, before you leave Nigeria, please visit our warehouse in a box. You'll be amazed, you'll be impressed with what we have there. It's an excellent facility, put together by Global Fund, USAID, and Nigerian support. We are showcasing what partnership can do. And to me, it will end the myriad of problems that beset our logistics supply chain system. So finally, I want to thank you all for being here. Thank you, thank you, thank you. And so it will be a combined opening and closing speech. Thank you.
Thank you very much. Can we again give it up for our special guest of honor and the Honorable Minister of Health, Professor Isaac Adewale. You must agree, somebody that has brought sanity and stability to the healthcare sector. And in case you didn't notice, he has a calm and methodic approach. We welcome him once again. Now, to give a quick remark to the welcome address by the Honorable Minister is the Director of Food and Drug Services. A short remark from pharmacist GMO Chukuma.
So do you want it there or at the restaurant?
Are you done now?
We're almost on. We're looking at your own time.
No, don't worry about it. We have for another 30 minutes.
So if, okay.
Once we are done, we can.
Okay, so if that's the case, so the government would like to read some keynote address.
Yes.
Oh, very good. Hello, ladies and gentlemen. Our action, Honorable Minister of Health, budgeted to be here 10 minutes. Now, he has graciously extended his stay to 30 minutes. And when he was written, what he just read was not written by us. You can see he was mentioning technical terms like FAFO and other logistics terms. So our Honorable Minister is, he's a logistics expert. So, so we will briefly hear from the head of supply management in the Global Fund. Briefly. Thank you, Martinellis.
Do we have the slides for the presentation? Oh, okay. Well, I just want to thank the Honourable Minister. I do have some slides, but if they're available. I know the Honourable Minister's time is very precious, so what I'll do is I will give a pre-seed version of the presentation. What I'd like to do, just to introduce this presentation, is I want you to let your minds go a little bit free. Think about the future. I know Africa, and particularly I know Nigeria with the NSKIP project is doing some wonderful things. But advancement means that you've got to think about the future. Effectiveness and efficiency doesn't come overnight. So what I want to do is just take you through a few slides, and I will skip quite a few just to make sure that we get through these quicker. So if you can skip that one, please, and that one, and let's start with the next slide. So I'm sure that you've all experienced these problems. You see them every day. Poor availability. We have long replenishment frequency periods, high buffer stocks, manual ordering, high degree of paperwork systems. These are things that we've got to try and fix and make slicker, faster, and more efficient. Thank you. We'll move on quickly. I want to introduce some provoking thoughts for you. Next slide, please. If we think about the supply chain as a value stream, then what you see is something that's represented by this chart. Okay. What we have here is we have, first of all, the quantification. We move on, and then we do the procurement, the ordering. We go to stock control. We then deliver, and we then have to transport it. Next slide, please. If And this goes back to Professor Ravi's comment about continuous improvement and about improving the efficiency of our supply chains. If you think about each one of these as potentially being a source of error and putting pollution into that river, you can tell by the end of it the customer gets very, very poor value. So we've all got to think about how we can improve the value stream. And, you know, it starts with data and it starts with quantification and forecasting. If you get that wrong, everything else goes wrong. So that is the key. The first part of all of what we should do is to make sure that we've got accurate and very timely data. Thank you. If we move on. Now, a lot of people think that warehouses are there because we want to stock loads of stuff. Well, that's not true. A warehouse is there as a point of diversion. It's something, it's a transition point. And what we tend to find is that very inefficient supply chains, like we've got here, this oil tanker representing the inefficient supply chain, is actually kept afloat by what I call the Dead Sea of inventory. Because what we do is we overstock. And why do we overstock? We overstock because we've got these problems. All these problems, too much paperwork, lack of KPIs, not enough data, accurate data, stockouts, keying errors. And that's, you know, because of all those problems, we have to have all of this inventory. And what we want to try and do is to become more efficient and effective. To become more efficient and effective, we've got to get the products faster and slicker through. As the Right Honourable Minister said, you know, we have to become more efficient and effective, and that means that we've got to become leading class. If we go to the next slide. So what we do here, we see by being able to fix through continuous improvement these problems of data, stockouts, paperwork systems, etc., etc., we're able to get rid of the problems, lower the water, the Dead Sea of cash, and that cash is then cash in hand. It's working capital that you can use and use somewhere else. So we can become more slicker. Okay, next slide, please. I want to show you a typical scenario here. And the top, so look at the top, we've got the central warehouse, the regional warehouses, the district pharmacies, the health facilities. And this is not uncommon, I see this in a lot of countries. We tend to have replenishment periods of about 3 months. And that's quite unknown in private sector for many, many different industries and commodities. I know it's quite common practice in African pharmaceuticals, but it's something I want to personally change. If you have to have 3-monthly replenishment systems, it means that at each node, at each point, at each warehouse, you've actually got to stock a lot more than 3 months. 3 months is the absolute bare minimum. And what we want to do is to become more efficient and effective and get those products through faster. Now, if we don't do that, and we do 3-monthly replenishment, or in some places it's even longer, you have to stock a lot of stuff at each of those. You know, if it's 3 months, you've got to have more. So typically, sometimes 5 months, 6 months. Why are we surprised that things expire if you've got 6 months at each one of those node points? That's 2 years of inventory that you've got in the system on day-to-day normal business. What we want to try and do, and what we need to move to, and something I did in Rwanda, I spent 2 years in Rwanda, I changed a quarterly collection system to a monthly delivery system. Now what that does is it takes that Dead Sea of inventory down. As you can see here, you don't need as much inventory at each point. You know, it goes down. If you're delivering every month, then you can reduce your inventories. You can become, and what happens is instead of something that potentially in here gets stuck and expires, with this one, it doesn't expire. Now, yes, you do have more deliveries, and that does cost you some money. But you need less space, less capital expenditure, less stock value, low expiration, and you have less emergencies. Thank you. So we'll just click through a few times. In fact, this is virtually the same picture, so we'll move on so we can get quickly through it. Next one. So if you look at this here as being typically what you see in the private sector, the Amazons of this world and the 7-Elevens, etc., they're delivering every day, every minute. You know, they're out there delivering something. The delivery time doesn't take long at all. Where do we see ourselves? We're typically up here. We're typically delivering 3 or 4 times a year. What we've got to do to become more leading practice is to get those replenishment periods further down here. So targeting once a month maybe. Now this takes time. It's not, you can't do it overnight, but that's what we've got to do if we want to become more efficient, more effective, stop exploration. Next slide, please. This shows you what happens with inventory. If you're running, let's say, a 3-monthly period here, you need at least 6 months, let's say, because you need some buffer stock, or 5 months, and then it runs down, and then at 3 months you get another delivery. If you can do it every month, you can see that the average monthly holding is much, much lower. And I'm going to show you what that means in terms of cash. Next slide, please. I don't know if anybody's heard of inventory carrying cost. Inventory carrying cost is that cost which you require for actually looking after the inventory you've got. And typically, it can be around about 15%. Maybe a little bit less because of bank interest. Let me explain why. For every $1 million worth of stock that you're holding, it's costing you about $150,000 in inventory carrying cost. 10% of that of it is heating, lighting, staff costs, forklift trucks, warehousing, etc. The other 5%, probably now lower nowadays with interest rates, is what you could get from a bank if you didn't have that money in inventory and you actually put it into the bank. So think about that. When you're thinking about all this working capital in your warehouses, think about how much you could actually save. So if you've got $1 million, and let's say you need that $1 million to look after quarterly replenishment, and you take it down to monthly, first of all, you get a one-time saving of 2/3 of that, so that's a $666,000 saving one time, and then you get $150,000 year-on-year saving. Or 50,000, sorry, 100,000 a year-on-year saving because of inventory carrying cost. So that's why efficient supply chains are supply chains that push through the products through the supply chain much faster. Thank you. Next slide, please. Quick word on parallel supply chains. Typically find that a donor and implementing partners, they go into a country, they see that the national supply chain's broken, they decide that they have to put in their own supply chain. Next donor, implementing partner comes along, they put in their supply chain. Before you know it, you've got maybe 6 parallel supply chains. Just think of the inefficiencies there. 6 times the labor, 6 times the computer systems, 6 times the finance departments, HR, etc., etc. And once you've got that model in place, it's very, very difficult to reduce it. And so what we need to do is, it does take time again, but we've got to work on eradicating parallel supply chains. Next one, please. And we'll keep going because I know time is now tight. So let's dream. Next one. This is my perfect scenario. Guy comes in with a barcode. We've all got barcodes on here, by the way. You can just download it straight away. You barcode their ID card, barcode the commodity, and you send it up into the cloud. Instant way of being able to do data analysis. Remember, I told you we're not going to do this tomorrow. This is something to think about in the future. But mobile technology is the way to capture data, if possible. Thank you. We'll move on. It's also something that we can use in warehouses as well. Handheld terminals. Data is key. Data is absolutely. If you get the data wrong, everything else goes wrong. Thank you. Next one. And we'll continue. I'm not going to sing too many praises, but I would like to actually thank Gloria and Linus for their dedication and their great leadership in the NSKIP project. Just move on, please. And again, they've been doing some amazing work in Nigeria. They're improving the patient access. They've got a tighter grip and control of all the partners and donors in Nigeria, and they're streaming the cost effectiveness of the supply chains. And I've got to take my hat off to them. I think they're doing a great job. Thank you. And we'll move on. So very quickly, just to round up, next one, please. And the next one, here we go. So I would like to make sure that everybody gets a copy of this before they go. This is how we're going to fix the supply chains. By looking at each one of these in turn. It starts with data, getting it right. It's introducing barcode. We're bad, by the way, at the Global Fund. I've got an initiative. I only started in 1st of August last year. One of my top priority number ones is to get barcodes on the packets, because if you can't measure it, you can't manage it. And at the moment, everything's being done by hand, and we've got to automate. So that's what I'm doing. But I won't go through the whole list. I'll let you read it at your leisure. But I'll just end by congratulating the delegates by coming here and being a part of all this. I'd like to thank the co-chairs for arranging this, and I wish you all the best in your endeavours to make the supply chains of Africa more efficient and more effective. Thank you.
Thank you, Martin Ellis. They are, like we told you, this the people that bring part of the money we spend. Our boss does supplies almost everything we need in this country. Now we need to take a photograph with our action minister, so that when we grow, we also become professors and ministers. Say amen. Amen. Thank you. The minister come. Yes, we photograph. You can go there. Take photograph, so we go there. Here. Yeah, so that we. Okay. Yeah. Down here. Let's see.
Honorable Minister, sir, we have poster presentations outside. Kindly oblige us a little of your time to view our scientific and poster presentation. It's obviously going to work fast. Mr. Lola.
Human resources and there are no commodities, you don't have a system. And so having this type of meeting to all, especially thank them. Offices here. It's global. Even a conference, nothing to be able to. I honestly hope that this will not be the end, because having number one is challenging, but number two is equally challenging. So I hope you'll be able to sustain the initiative. I'm also told that this meeting is holding to really showcase Nigerian local content success story, particularly to other African countries, and that you are facilitating a platform to share experiences, best practices, and so on and so forth. And I believe resources and there are no commodities, you don't have a system. We've been able to.
Ladies and gentlemen, can I have your attention? Quick attention. After the private talk the minister will have with the LOC, in 10 minutes, we'll be going for lunch in 10 minutes. Remember to collect your tickets just at the secretariat. In 10 minutes, we'll be going for lunch. Thank you.
Provide access, global quality, and affordability in the context of healthcare delivery. I want to recall of our previous efforts and challenges in the Federal Ministry of Health. This is no longer a story. Let me thank all our partners, USAID, Global Fund, DFID, UNFPA, Bill and Melinda Gates Foundation, UNICEF, Private Sector Health Alliance, and other local and international partners. I want to thank you for putting this together. I believe that in the course of this, we will be able to really look at what we have in Nigeria, discard whatever is not working, reform what we have, and come out with what is best. Not only with relevance to Nigeria, but with relevance to international practices. I think what is Nigerian is not good enough. We must be able to get it right in a way that the entire international community will say, yes, they have one of the best logistics supply system in Nigeria. I hope that this meeting will continue with respect to the expectation. I'm sure you've met your expectation in terms of the participation, local and international, exchange of information, making new friends, getting to know what is happening in other places. I hope that you've been able to meet this expectation. And I also believe that a rich mix of local and international participants will help us to come up with a better idea that will help to promote. Let me thank all our